Welcome to the Chad G Ortho OT Podcast. I'm your host, Chad Guerrero. I'm an orthopedic occupational therapist, strength and conditioning coach, sports trainer, and I hold over 40 specialty certifications in manual therapy, orthopedics, and sports medicine. On this podcast, we will discuss everything orthopedic therapy, sports medicine, and more. If you're a therapist, health and fitness professional, or someone just wanting to learn more about the orthopedic and sports medicine world, then this is a podcast for you. Let's get started. Hey everyone, welcome to the episode of the Chad G Ortho OT Podcast. I'm your host, Chad Guerrero. And today we're going to discuss a little bit about, does your imaging that you have done, x-ray, CT scan, MRI, does that always match up what's actually going on? Do your symptoms match what your imaging, shows? And then also based off of the imaging, what's the indication or the correlation to like true dysfunction that you're having? And so I think this is something, and this is just my preference really, and based off of my experiences, and primarily, and people when they come in, and they'll say, okay, did you get my x-rays or MRI or whatever that is? And a lot of times, kind of how things are now, unless you're in a cash-based setting and all of that, like you have to go to therapy for so long before you can have an MRI. But a lot of times the x-ray is the first thing that's done. And so you have people come in and say, okay, did you get my x-rays? And my x-rays, I was told by my doctor or whoever that, I've got this, and this, and degenerated this, and degenerated that. And maybe if they've had an MRI or a CT scan, they've got, all these disc protrusions and herniations and, spondylolisthesis and, et cetera, et cetera. And, so they automatically have, I think a lot of times this predisposed concept or thought process that, man, I'm in bad shape, right? Like the stuff that I have coming in with, my prognosis is poor. And it especially if it's been going on for a while, and a lot of times it has, unless you have some sort of traumatic event or some sort of accident, or you're a professional athlete or something like that, where you can have access to this imaging and treatment right away. For most people, it's been going on for a while. You thought it was going to get better, didn't get better, and you probably just keep going back to your doctor or therapist or whoever you're seeing. And so when, it's just kind of human nature when we get this report. Of course, we go right away to Googling things, which, again, I'm not against. I don't think that's a bad thing. Just always keep in mind you're going to get worst case scenarios usually. And so you get this report and it says you got this, and this, and, this is not looking good, blah, blah, blah. And so I think that already puts you in the mindset of, well, I don't think that therapy is going to help. We're going to use, obviously, therapy because that's what I do. I don't think therapy is going to help, and I'm going to need surgery and all these kind of things, Now, I'm not saying that surgery is not important, and it doesn't work. It does work for a lot of people. But there are a lot of people I feel like that probably have unnecessary surgeries, or they have the surgery and it didn't fix the problem because maybe that was not the causative factor and the reason they were in the shape they were in to start off with. So, I'm just going to give you some examples. I had a lady a while back that come in and, both knees, pretty arthritic. And the right knee was pretty severe with the arthritis. And, it's based off of x-ray, it was in really rough shape. But the knee was stable. That knee never really gave out on the patient. And the patient said the pain is okay. It's like a little achiness, on an analog pain scale, 0 to 10. She's like maybe a 3 or 4 tops. And the left knee on x-ray actually was not that bad at all. A little, wear and tear. Had instability and slack in the joint. And she says, I've got a pain of, 8 to 10 out of 10 on this one. And the left one is the one that I want my doctor to operate on first, but they won't do it because, the right one's in worse shape and insurance will approve the right one to be done, et cetera, et cetera. And so that's a great example of just because one imaging shows one thing doesn't mean that that's the way it is. And then what's going to probably happen is, this lady has surgery on the leg that's her stronger, more stable leg that she's going to use to support, the one that they want to operate on. and then you're going to have issues with that. So I don't think that's really the way to go. You got to be considerate of that. And I also had another lady that had come in, and neurosurgeon went to for her neck, and she's having radiating pain and symptoms down the right arm and hand. And so the neurosurgeon tells her that she's going to have surgery because she's got a spur that's touching the nerve where it comes off in her right arm. And she's very specific on this and remembers it exactly what she was told. And so I had her MRI report, and I'm looking at the MRI and had her X-ray report. And I said, the spur is touching the right side, and this pain and numbness and sensations going down the right arm and the right hand, right? She's like, yeah, it's going to the right side. And so I said, well, that's interesting because based off of this imaging report, 2 different reports, right? One X-ray was performed one location, read by one radiologist, and then the MRI at a different location, and then read by a different radiologist. And the spur is on the left side, not the right side. So, and she had no radiating symptoms down the left side whatsoever. This was only right side, that she was having. And so, anyway, basically, so we treated her for like 2 weeks, and guess what? The pain and radiating symptoms that she had down the right arm goes away, and she avoided surgery. She said, it's fine now. I don't have any issues now. I can use my arm, on all planes of movement. I can move my head and neck, and I don't have any pain or tingling that goes on the right arm or anything like that. And so, again, another great example of it doesn't always match. So, and I'm not saying that imaging and things like that don't have a value, because obviously they do. But, the perception of how the brain perceives threat, pain, inflammation, etc., sometimes can become skewed. So that's just something to think about. Try not to, when you go in and you have your imaging done, when we're talking about musculoskeletal, dysfunction, issues with, muscles, tendons, ligaments, bones, nerves. When you have this imaging or testing done, try not to be too discouraged by it, because, especially if your pain or your symptoms fluctuate throughout the day, that's a good sign. If it stays constant, it's always hurting from the time that you wake up, the time you go to bed, and it's unrelenting, then that's obviously your prognosis is not as good. But if you have periods where the pain improves or the symptoms improve and it fluctuates, then there's a good chance that your prognosis is going to be much better. And again, the thing about it is your imaging is what your imaging is, right? Like, it doesn't change. Like, your MRI doesn't change 3 times during the day. But your positioning and postures and activities and load level on the tissues and all that does have an effect on that. So, that's just things to be considered. So, but I just wanted to just kind of touch base on that. And as far as, don't always just, hold so much stock in, what the imaging shows. So anyway, thanks so much for listening, guys. The time that this comes out, it probably is going to be the day before Thanksgiving or Thanksgiving. I'm not sure. So happy Thanksgiving to everybody out there. And I appreciate everyone so much. I'm very thankful for all of my patients, clients, staff, and of course, listeners and folks that follow me on social media. Thank you guys so much, and you guys have an awesome day. This podcast is brought to you by Guerrero Rehabilitation, setting the bar for rehabilitative and sports medicine care.